The Fox Carolina Health Minute is sponsored by Spartanburg Regional Healthcare System.
Well, if you were to encounter somebody in an emergency situation, like right after a car accident or shooting, would you know how to stop their bleeding?
Yeah, probably not a lot of people would. Well, Spartanburg Regional Healthcare System, they're trying to educate the public on how to do that through the Stop the Bleed campaign. Fox Carolina's Alex Abbott explains.
In an emergency situation, stopping an injured person's bleeding can mean the difference between life and death.
We have about 5.5 liters of blood in our body, and if you cut one of the major arteries in your body, that can bleed at 0.5 liter a minute.
Dr. Christine Lombardozzi is a trauma surgeon at Spartanburg Regional Healthcare System. She's helping to train people as part of the Stop the Bleed campaign, which began shortly after the Sandy Hook shooting. The program's original goal was to make sure people are prepared for mass casualty events. But the training isn't just for shootings.
You're more likely to encounter a significant or life-threatening bleeding event in a car accident, in a home accident, work. And even under the best of circumstances, first responders take time to get to you.
Funding for the program came after Spartanburg Regional Healthcare System reached out to the Upstate Healthcare Coalition last year about a grant to put bleed kits in schools across the upstate. They went to the state's Preparedness Advisory Council, who decided to adopt it across South Carolina. Now, the campaign has widespread support.
All the trauma centers across the South Carolina footprint. It also includes DHEC EMS and trauma, DHEC Public Health, major hospitals like Spartanburg, MUSC, Palmetto Richland, and the Grand Strand out at Myrtle Beach. So it's a collaborative partnership amongst all these hospitals.
The bleed kits come in different sizes. Some fit in your car, while others mount on a wall.
It has gloves, scissors, gauze, it has a tourniquet in it, and those are the basic tools that you need to stop almost any kind of bleeding that you might encounter.
While the bleed kits do have a pamphlet on how to use them, Spartanburg Regional Healthcare System is making sure people know what to do step by step.
It's pointless if we have the kits but do not do the teaching, because then it's just like artwork, right? It's something hanging on the wall.
TJ Mack is the Trauma Injury Prevention and Outreach Coordinator. He's part of the team that goes around to different upstate schools to explain how the bleed kits work. He says you don't have to be a student to learn these skills.
Anybody can receive this training. The most important part is having these two hands. These two hands can truly save a life. And you can be, we teach it to high school kids, we teach it to teachers, we teach it to our grandparents. Anybody who is willing to learn and wants to learn and is going to get up and help when there's an incident.
The training focuses on the ABCs. A is be alert.
Most everybody has a phone or knows somebody, and you're in a group, you can, point and say, go call 911.
B is bleeding, which involves identifying the wound and moving or cutting any clothes that make it hard to see. C is compress. That's where the bleed kits come in.
So we either stop the bleeding by using a tourniquet above the wound, so we cut off the blood flow to the wound with the tourniquet, or we take our packing and we're going to pack inside the wound, again putting pressure all the way around so that we can slow down and eventually stop that bleeding.
According to Mack, it takes up to 10 minutes to stop the bleeding. But with blood loss being a major cause of trauma deaths, this means that citizen responders at the scene could save a lot of lives.
About 40% of traumas die from blood loss. So if we can keep the blood on the inside, we do give these people a better chance of survival.
With such high stakes, the situation may get intense, especially since the process will cause the victim pain. But the key is to stay calm.
Tourniquets hurt. So these people, they may be yelling at you, they may be asking you to take it off. Do the best you can to, one, stay calm yourself, and then two, keep them calm. And know that, okay, they're yelling at me. That means I must be doing a good job.
Stop the bleed training could be a game changer during emergencies.
You can save a life, and it's pretty powerful. And I think the more that we can help people realize what an impact that you can have on an individual, the better off we're all going to be.
We do have to mention one thing as part of our Health Minute, sponsored by Spartanburg Regional Healthcare System. Upcoming skin cancer screenings, very important.
Right, skin cancer is the most common cancer in the United States, and to fight it, Spartanburg Regional Healthcare System is offering free skin cancer screenings next Thursday. That's May 10th from 5 to 7 p.m. The screenings will be held at Gibbs Cancer Center. Now, the screening is free, but you do need to register in advance so they know you're coming, and you can do that by going to spartanburgregional.com/screenings or call that number on your screen, 560-6747.